The benefit's tremendous. There are a number of things we get to do with it. We get to take the residents who are in the process of learning and have them maybe see complicated cases, take them through things that are emergent but they may not see very often, to see things where they don't have time to go look things up or react. They have to know these things. Gives them the opportunity to rehearse, to practice, to learn in a more realistic environment with a little bit less pressure, still a certain degree of pressure, but less, so that they perform better when it's the real thing. It's a service to the public as well, because it just makes them better doctors before they even care for the patient.
You are working at a small community hospital, and you are told that there's a patient in room A that has complaints of a sore throat. He's a 44-year-old gentleman. His history of insulin-dependent diabetes. Here's the rest of the information that you'll need that you would normally see on the chart, and go to it.
I've done the majority of the scenarios for the emergency medicine residency, and the best part is, for the residents and for myself, is I never take them through a patient I haven't seen or one of my partners hasn't seen. So it's all very real, and using the mannequins, the high-fidelity simulators allows us to make it even more realistic, adjust the pupils, the heart rate. These things can sweat. It's quite amazing. Well, I'd want them to know that it's a great place for them to learn how to do their trade in a safe environment. Immediate feedback. They know how they did. We can even videotape it. It's a great learning opportunity, and one really I wish I had had when I was a resident. All residencies should be doing this, and most residency programs are going to move towards it. We're just a little ahead of the curve. We're blessed. We have great faculty. We have a bunch of young, very, very smart doctors who are enthusiastic and who love to teach. And then we have a couple who have more experience but just are here because they love to teach. And the ability to bring cases out of their own perspective, out of their own past, ones they've really seen, share them with the residents, explain what really happened. It excites them as well. We share the load, and it's not a burden. We enjoy doing it. I came from an inner city hospital, level 1 trauma center that saw a lot of people and had every subspecialty you could think of. And we're practicing here in Johnstown, Pennsylvania, to a level of where they are or higher. And it's a great environment and a great place to be, and you get a great medical education while you're here. It's always a process in development. It wasn't being used much for the emergency medicine residents, to my understanding, when I first came here 2 years ago. We now use it at least 3 out of every 4 Thursdays. We run them through the cases. We actually have lists of things we want to make sure we cover. So we're no longer hoping that during the time of their a resident during their time of their residency will see this kind of patient. We are now ensuring that they see this kind of patient so that the first time they see it in the real world, they're comfortable and they know what to do. It's changed medical education quite a bit from that perspective.